Hello, good afternoon. My name is Dr. Chudi of Snowspirations Global Health Solutions. Today is our weekend open clinic in YouTube. Today's topic is very important for so many reasons. So today we're going to look at two procedures which are actually permanent contraception. So we're going to look at the possibility of achieving pregnancy after vasectomy. And we're going to look at the possibility of achieving pregnancy after bilateral tubal ligation. So it's important to understand that vasectomy is a permanent method of contraception, permanent method of preventing a man from impregnating a woman by tying a particular tube that conducts the sperm inside the male reproductive system. So in vasectomy, we have some tubes, which I'm not going to bother you with the medical terminology. It's pretty much complicated, but we go into the scrotal area, find those tubes, and we ligate them. That means we tie them. There are different ways of doing this. We can cut it off and use a special, tape to tie them, or we can suture them differently. Now, the essence of doing this is to achieve permanent contraception. Now, unfortunately, some men might use this as a method of contraception, and later they might want to come back to start having kids. When you are going for vasectomy, you need to understand the reason why you're doing it. You need to understand that if you're going for vasectomy, it's meant to be permanent. However, in some select situations, after you're done with the vasectomy, pregnancy is still possible, though very limited chances, but pregnancy can still happen. In some situations, depending on the presence of sperm in the remainder part of the tube, after the process, if a man engages in lovemaking with a partner that is healthy and has some potentials of becoming pregnant, pregnancy can happen. But if you want to become a father after going for vasectomy, there are medically two things you can do. Number one is to have what we call reversal vasectomy. It's a surgical procedure that a renowned urologist, someone that has gone to special training and has done this, will carefully go back to the same place that was tied and untie and join it together. It's a very sensitive procedure, but in some situations, these men can still regain their fertility and go back and have their family again. But you have to understand the reason why you're going for vasectomy. There are different types of contraceptives you can try. Whenever you talk about vasectomy and bilateral tubal ligation, you are going into permanent contraception. Permanent contraception means it's irreversible. So pregnancy is still possible in a man who has done vasectomy, depending on age, depending on the quality of the remaining sperm. So when you go for vasectomy, it doesn't mean you don't ejaculate. You still ejaculate, but in that ejaculate, there is no sperm. So when we succeed in doing the reversal surgery, we can re-establish flow of sperm into the semen so that your ejaculate will contain sperm. So pregnancy is possible in these men. Now, besides going for this surgical correction of a vasectomy, the only other option for a man who has had vasectomy to succeed in becoming a father is to go for IVF. So long as you're still producing sperm, because the problem is not that you're not producing sperm, you're producing sperm, but we've cut off the bridge. So we can still go for IVF. So during IVF, what were we going to do? We're going to go directly into the place that the sperm is produced and we collect the sperm. So we tap the sperm from inside. Then definitely, everything pregnancy happens in the body of the woman. So IVF is also an option for men that have vasectomy. If the surgery for reconnecting the tubes fails, you go for IVF. Now, coming to bilateral tubal ligation, I'm going to demonstrate. So this is the female reproductive system. When we are opting for bilateral tubal ligation, what are we doing? We are tying these two tubes. We are preventing the sperm from coming in. We are preventing the eggs from coming in. And we do it bilaterally. So this is also a permanent form of contraception. You can only go for this if you know fully well you no longer want to have kids. There are some women that have what we call high fecundity. High fecundity means you have a higher probability of becoming pregnant every month. If you have completed your family and you know that you have a lot of complications in your previous pregnancy, bilateral tubal ligation is what is recommended. It's a surgical process. We go there and tie your tubes. There are different ways you can do this. I'm not going to bother you about the methods and all that, the details. But just know that it's possible for a woman that had bilateral tubal ligation to also be pregnant. Pregnancy can happen by itself. Now, the problem with pregnancy happening from this particular process is the possibility of having ectopic pregnancy. Because once we have compromised with the integrity of the tubes begins to have some complications. What are the complications that can happen in someone that had bilateral tubal ligation that became pregnant is what? Possibility of ectopic pregnancy. In ectopic pregnancy, the pregnancy will continue to develop in the tubes instead of traveling to go to the womb to start developing. So possibility of pregnancy in BTL is there. In cases that we have statistics, 1 out of every 1,000 women will become pregnant, despite using BTL. Very tiny, but it's possible. Now, the other way of achieving pregnancy in a woman that had BTL is also to go for reversal bilateral tubal ligation. So we can still go back and undo the ligation and reconnect the cut-off tubes. Most times it will work. Most times it will not work. Few times it will work. Now, the other option left for a lady that had bilateral tubal ligation is what? IVF. Because during IVF, what do? We collect the eggs, we collect the sperm outside the body of the woman, then when we are done, we put it back. So pregnancy is still possible in couples that had bilateral tubal ligation and vasectomy, but you have to understand what you need to do. The best recommendation for me to those couples is to don't waste your money doing nothing than IVF. So if you have vasectomy, probably you had a bad relationship and you recently came into a good relationship and you still want to have your babies, I will recommend you go for IVF without wasting time. If you have bilateral tubal ligation, you completed your family, but somehow you had another relationship and your partner currently wants you guys to have babies, go for IVF. Don't hope on things that might likely fail. So this is my presentation. I'm going to quickly open the floor to give you an opportunity to ask your questions. So if you have any questions, please quickly ask. I'll provide you feedbacks. We're going to round up in next 1 minute. Now, remember to join me in Facebook. I'm going to repeat this same clinic in Facebook. Remember to register for the event coming up on the 30th of this month, Advancing Maternal Age Summit. So if you're 35 years and above, and you are believing to become a mother and it's becoming difficult, this event is meant for you. If you're currently in your 40s, in your 50s, in your 60s, and you still want to be a mother, please attend. There is no age that can stop a woman from becoming a mother. Any woman at any age can be a mother, but it's not all women that can become pregnant to become a mother. There is a difference between becoming pregnant and becoming a mother and becoming a mother. There are so many ways you can become pregnant. There are so many ways you can become a mother. The bottom line is to become a mother. Every woman is born a mother. So if you have challenges based on the age you found yourself, there are so many ways you can get help. So motherhood is grossly a choice you make, just like fatherhood is a choice you make. So make sure you attend that event, and I'm going to make sure I do my best with my crew to give you the best. So if you don't have any other questions, once it goes to the top of the hour, I'm going to round up the clinic. Then you join me in Facebook. So it's 10 minutes. My time is up. Thank you for coming. Enjoy the rest of your weekend, and bye-bye for now.